My name's Diana Heckram. I'm the Associate Director of Transformational Change at Healthcare Improvement Scotland. And I'm delighted to have within the team and in the work plan that we have a systems change team. That team is there to help health and social care in Scotland deal with some of the really difficult decisions that we've got facing us just now. And within that team, there are our two senior strategic planners and our strategic planning advisors. And the real special place that they play is that we know within our system that we write plans and we write policy and we look at structures, and they are there as if A follows B. But we know that the world as we look out on it feels much more chaotic and complex than that. And with the challenges that we've got, unannounced, unexpected elections popping up out the blue, and the fiscal challenges that we're all facing, there's still unknown impacts of our post-COVID reality, and the impacts of austerity, the changing dynamics of artificial intelligence and a more digital savvy younger cohort of people, and the different needs and support available to our older people, is a really chaotic and challenging landscape for us to try and plan within, because it is not orders as A to B. The role that is not here on this picture is the role that planning plays. It is neither the person who is naively trying to assume that we're following A to B, nor are they the person who is confused and surprised by that chaos outside. They are the really helpful role that tries to make sense of that chaos, that tries to put some order and structure to it to enable us to function sensibly in amongst all the chaos. There are no right decisions, but there are good decisions. And the more that we plan, the more that we use the range of skills and tools that will be shared with you this morning, the more that enables those good decisions to be made, ones that aren't short-sighted decisions which benefit one part of the system but cause much greater chaos more widely. So we know there are times when the desire to cut a single service causes huge ramifications on other services which are far more costly and damaging both to our financial sustainability of health and social care, but more importantly to the lives of people and the quality of care that they receive. And sadly, in my experience of doing this kind of work over the last several decades now, because I'm getting to that point in life, is that quite often has an impact on our most marginal populations, that those people who are unable to advocate for themselves, for those people for whom the system is not designed for. So we know when we did some work with one of our A&Es and the planning team around an A&E in one of the health and social care partnerships, that the people who were coming 22 times within a year to A&E were there not because they were constantly falling over or having accidents or being hit by a car, was because they didn't have heating, because they didn't have lighting, because they were suffering from unsupported grief, they were dealing with an addiction, they were dealing with a mental health crisis. But because the funding wasn't targeted at those areas and the funding was being targeted at A&E, the people just kept coming back. When you make that shift and they put in a service model that looked at providing direct support to the 30 odd individuals that they had who were coming more than 20 times in a year, they actually stopped them coming more than 20 times. They came once, if any, subsequent to that. And that's the sense that planning can help make. It can help identify the reasons why that systems have demand on them that are not apparent in that part of the system, and they can show where resources can be better managed. They can help break down the silos. One of my well-known expressions is the good stuff is in the dull stuff. And if we are really to get ourselves through this sort of post-COVID, post-austerity system, then being able to see our opportunities as a whole system, to be creative, but organised and rigorous within it. And I think that's the real skills and the importance of transformation and the role of strategic planning within that. So I'm delighted that we've got nearly 70 people on this webinar this morning, and the team and our colleagues from across health and social care, and some of our most experienced strategic planners working in health and social care right now are here to be able to share their knowledge and skills and really begin to build a community that can learn from each other so that we can adapt to our changing complex model and our changing environment that we find ourselves in, but still delivering the best outcome for the people of Scotland. So I'm delighted to be here to hand you over to Claire, who will be taking you through the agenda and stuff today, and to welcome so many of you to this webinar this morning. Thank you, Claire.
Perfect. Let me just sort the slide. Can everyone see the agenda slide? Making sure I'm pushing the right buttons here. Brilliant. So what we're going to do today is just explore the resource that we've developed and published. The idea is that at the end of this, you'll be able to get a sense of familiarity when you look it up yourself, that you'll be able to navigate it yourself, and that you'll be able to understand how it's structured and how to use it. There's a lot of content on these slides, so that way it's helpful for people when they're watching back, or there's things that we need in order to check back and reference, but we're not needing to go through all of the detail through today, so don't get too overwhelmed if there's loads of words on the slide. So what we're going to look at first is why we developed the Good Practice Skills for Strategic Planning resource. We're going to go a little bit through the kind of history of its development. We're going to explore the themes and the skills and the competencies that are within the resource, and then we're going to look a little bit at how to use this in your teams. And we've got two presenters today that are joining us, one via video from Dumfries and Galloway, Viv, and Wendy from Claxon Stirling HSCP, who's actually with us in the virtual person, to just talk about their experiences of using the resource. And then we're going to have an opportunity for you guys to ask any questions. As you go through, if there's questions that come up, just pop them in the chat, and then we'll be able to use those during our question and answer. So the first one is around why we developed this resource. As kind of Diana started going through, strategic planners have quite a unique worldview, and we play a really vital role in the planning and development of services. And we're able to provide really useful insight and evidence that support decision makers to work out what support should be provided and how it should be provided. In particular, when we think about what strategic planning's unique value add is in any setting, we kind of look at three different points. The first one is that we look at the system. So we don't look at a service specifically or an organisation specifically. What we're looking at is how the system interacts with each other. And as a result of that, where are the problems and where are those solutions, which are not necessarily within self-contained boxes. The next one is that we start from a point of understanding need and not necessarily a point of understanding the current service or the current demand for the service as your starting point. And it means that we're looking at need now and into the future. So that means the third one is around looking to the future and that long-term planning and being able to look at those long-term shifts that we need to be making now in order to see changes happen in 20 years. But we know that there are systemic barriers to doing good strategic planning within health and social care. We know that resource planning means that short-term planning, resource pressures mean that short-term planning is often prioritised over long-term planning. We know that as we've moved from an environment 20 years ago where we planned at the service and organisational level, and now through integration we're planning at that system level, we know that there's a need for new tools and approaches, but there's a lack of capacity in the system to be able to invest in the development of those. And the third is that strategic planning doesn't have that same professional development infrastructure that other parts of the health service and the other parts of the social care service do. It means that we often struggle to recruit individuals who already come with those skills. And we know that because we don't have that organised and coherent identity as a professional, as a profession, it means that we can get a variation in how things are done. So this resource looks at that third one around the infrastructure and whether there's more that we can do to build that infrastructure. So we know from our work with planners in the system and as part of this development that strategic planners tend to have middle to senior management experience and an ability to understand really core issues and opportunities that will typically span a long duration. And they'll often be multifaceted, complex, and challenge the way that our cultures run within organisations. In the recent years, we know that we've seen significant financial savings, and strategic planning roles have often borne a disproportionately high share of those payroll savings. And that really further reduces that strategic capacity that we build into the system. And we know from engaging with strategic planning teams that teams are largely left to themselves to identify, recruit, and build the skills that they need in their teams. So we sought to develop a resource that would outline the skills and the competencies that we envisage in a strategic planner. So we started this journey in 2022, where we developed an initial prototype. And then we tested it with our team during the early parts of 2023, and that led to a further round of development. We then took it out for external prototyping. So we worked with Dumfries and Galloway, Glaxon Stirling, NHS Lothian, and the Scottish Ambulance Service to test it with their teams. And through that refinement process, we were able to publish it in March. The good practice skills for strategic planning is aimed to support local planning teams to identify and build the competencies that are required to consistently implement good strategic planning. It's designed to be a tool to help you frame conversations between staff and managers as part of your annual process. It's also a tool to help managers to work out what kind of skill mix they want to foster within the team. It follows the 5 themes of the Good Practice Framework for Strategic Planning: building a planning culture, analyse, plan, deliver and review. And it's designed to complement existing processes and resources. It's aimed to be honing in specifically on strategic planning specialist skills rather than acting as a general skills framework. But what we have done is that we've pulled out ideas that we think are enabling competencies. So a couple of general competencies that we think are really important in being able to deploy strategic planning skills effectively. It's really important to note that this isn't a template for an ideal strategic planner. We don't expect that one planner would realistically or should hold all of the skills detailed in the resource. Strategic planners have a rich diversity of backgrounds, experiences, and skill sets, and that is a really powerful strength in enabling teams to tackle complex problems innovatively. So what we want to do is bring a better understanding of the role that strategic planning plays in the system and provide a consistent language that we can use around roles, progression, and development, rather than articulate that each individual needs to have all of those skills to be considered a good strategic planner. The Good Practice Skills for Strategic Planning resource tries to bring together 2 elements that we feel are really core to strategic planning. The first is a mindset, a worldview, a way of thinking and approaching things, the way we question, the way we add value to the conversations and the analysis and the thinking that's happening. And we call that worldview of a strategic planner. And the second is the technical set of skills and tools that we use to create, analyze, plan, and communicate, the really kind of technical doing activities. So the resources aim to cover both of those in different ways. Each component of the resource has 4 areas. The first is a description of the theme. So we talked about the 5 themes within the Good Practice Framework for Strategic Planning around building a planning culture, analyse, plan, deliver and review. What it does is it says, okay, lots of areas do this. Everybody analyses, everybody plans. It's not just the realm of strategic planners, but what does it mean to do it as a strategic planner? What is the way and approach that a strategic planner brings to that that's different than those other skill sets? The next layer down is that within each of those 5 themes, we identify key strategic planning skills. Those are the activities or actions that strategic planners do on a day-to-day basis. And within each of those skills, we break down further the competencies that are required to actually fulfill those skills effectively. and then running along the bottom are those general enabling competencies. So what we're going to do is have a look at some examples of each of those 4 areas, just to give you a flavour of what that resource says and includes and how you can use it. So the first one is around the theme and description. So what we're saying here is, in order to build a planning culture, what we mean is that strategic planners understand the role of strategic planning within the organisation. They support good planning both within their teams and wherever planning is happening within the organisation. And so that means we do it in a way that advocates for the inclusion of public services, service users, workforce, providers from all sectors, professional groups, politicians, partners, and they're all bringing together who those stakeholders are around the table. We advocate for a workforce to be as defined as widely as possible. We're not just talking about those employed by the NHS or by the local authority or who are deployed through the HSCP. We're talking about those third and independent sector organisations and their workforce as well. If we look at what it means to analyse as a strategic planner, what it really means is understanding that problem, that need or an idea at that wider system level, and to be able to deploy intelligence from multiple sources of qualitative and quantitative findings in order to be able to provide insight into that system level. So we know that what we're wanting is clearly identifying what the need is, what it feels like, what the comparative, what the normative and expressed need is, those different features of it, rather than looking just at the demand and your management data from your services. We know that to analyse as a strategic planner, you're looking to understand what's driving that need and not just the symptoms of that need. And that we know how we are able to look at the trends and things that are going on in the future and draw on evidence from PHS about the future needs that are coming down the line and be able to put that into our long-term planning. Within each of the themes, there are some core skills. Most of them have around 4 or 5 core skills in them, some of them more, some of them less. Within building a planning culture, the skills that we've identified is that we feel like strategic planners need to understand the role that strategic planning has to play. When do you get involved? When are you not needed? What role are you playing when you are in that room? We feel that strategic planning skills around understanding those relevant stakeholders to include in planning, and that's often us saying, take it wider than others might be in the room. Around that building a planning culture is the ability to bring people together to develop a shared vision and values and objectives that help centre that planning activity. And the last element is around that ability to support planning across the system, because planning happens across organisations and not just within specialist planning teams. Within analysis, we talk about the need to understand the strategic context, to assess that population need, to be able to assess the quality and effectiveness of our status quo, to know what good looks like, and to be able to compare all of those things to be able to identify the gaps. Within plan, it's this comprehensive and consistent approach to assessing options for change. It's taking people beyond the let's get in a room and figure out what we want to do about a solution. And that is the solution at the end of the meeting. And actually saying we've got so much insight and evidence and triangulation of insight that allows us to do a comprehensive assessment of what are your broad options for change and how do they work against the different criteria that we need. There's a skill there around writing strategies and plans and to contribute to the design of services and support as a strategic planner. Within Deliver, there's this element of translating those plans into commissioning decisions. What do we start, stop and keep? And this is commissioning in its bigger picture word and not the technical terms that we use it in. So this is beyond the fact that the interaction between IJBs and NHS boards and local authorities is termed commissioning in the legislation. It's beyond the idea that commissioning leads to an external procurement process. It's the idea that inherently when we are making decisions as leaders in that space, leaders are saying we're going to start this, we're going to stop this, and we're going to keep that. And that set of decisions is commissioning. And then it's that supporting the ongoing implementations of strategies and change, which might require a shift in the role that you played from when it was at that earlier stage of analyze and plan. Within review, it's the idea that the things that we measure as strategic planners around success might be different than those who are doing it from a operational management point of view, or even a performance reporting point of view. That there are metrics and ways of understanding impact and monitoring success that we might put on the table that's different than if our voice wasn't in that room. So that's not saying that we do the review ourselves or even referring to the review of our own work. It's that we're able to contribute that world view to a well-rounded set of review activities done by your organisation. And the 5 general enabling competencies that we've really drilled in on are around your ability to influence, your confidence and ability to work with complexity and uncertainty in a way that doesn't oversimplify the world to make planning easier, in a way that actually goes, okay, how do we operate and what do we do to make change within that complex environment? The ability to communicate those messages underpins all of these different themes. And the innovation, the creativity, and the problem solving skills, the number of times that strategic planners get brought into a room because we can think differently and we get asked, what can we do to think differently about a particular topic? And leadership. A lot of the impact of our work involves being able to corral people around an idea and get progress long after the intensity of our work stops. So within each of these skills are a range of competencies, and I'll just give you a couple of examples. So within understanding the role that strategic planning has to play, which sits within building a planning culture, you can see all of the levels starting to break down. We need to understand and articulate what good strategic planning is, and that unique viewpoint of a strategic planning focused on the whole system, future focused and starting with need. The ability for us as planners to be confident in a room saying, this is what planning is, this is what it does, and this is the value that it adds. That knowledge of and understanding of where planning is happening in your organisation and within the system, so that you're able to spot and proactively engage with parts of the system that planning is happening, rather than being brought in at the very last minute when you've just become aware of something or they've just become aware that they probably need some planners in the room. Being able to understand what tools and techniques and approaches that you might find useful to deploy in any given setting. There isn't a start and end point that you move through the natural stages of a strategic planning. There might be parts where you're going in for specific activities or using a specific tool, and the ability to interpret and analyze and diagnose what is needed in that environment and say, okay, it sounds like you need an options appraisal. It sounds like you need a gap analysis. It sounds like you need us to bring together the workforce at that broader sense and start the vision and mission based on that. If we take another example of some of the competencies around, so this one sits under analyze, and it's around that assessing the population needs skill. So what we're saying here is we need to be bringing in evidence and insight from multiple sources, both data and qualitative insight, both locally held, nationally held, area information that is held from other parts, other people doing similar things that you can draw learning off. And being able to use that to get to the heart of the problem and say, yes, the most obvious answer might be to treat the symptom, but let's get to the root cause. Let's address those drivers further upstream and understand and get to the heart of what the challenge is. And then another part of it is being able to articulate the implications of that population need on the design of services and the change programs and the transformation that we put in. Some examples of competencies sitting under the plan function is around the skill of assessing options for change. So this is the importance of being able to articulate what your options are, to come up with those options. And they might be at a really high level, which are your broad strategic choices of an organisation that they could make about where they focus, right down to we need to support this particular population group, say mental health and substance use integration, which is what we're working on an options appraisal for at the moment. and saying, okay, what are the broad options that we have for models of care and models of transformation in this? And being able to articulate really clearly what the criteria are for success, beyond those high level of effective, efficient, politically acceptable, environmentally sustainable, but to actually drill down and go, what do we consider our metric of success? And then being able to pull on good practice, your assessment of the status quo, your assessment of gaps, your qualitative and quantitative evidence from lived experience, data from services, insight from staff and leaders, and be able to comprehensively assess those options against that criteria beyond the tick in the box about whether they meet that criteria or not. If we look at an example from Deliver, one of the skills there is about supporting the ongoing implementation of strategies and change. And so one of the things here is around utilising our strategic planning insights and perspective to influence the way that those strategies and change programs are implemented. So what that means is having a look at the long-term objectives and being able to set short and medium-term goals along that way without getting stuck in the continual spin of everything we're doing is short-term planning. So being able to have that long horizon as well. The being able to adjust those plans in the light of new circumstances, being able to look at that whole system throughout the whole life of the program and not drilling down and losing that bigger picture when it moves into implementation. And being able to work with stakeholders to be able to get to a point where everybody has consistent understanding of your respective responsibilities and that point of handover or the shift in the role that you're going to play from probably quite intensive at the beginning to playing a longer term but lower intensity role throughout that. And if we look at the one under review, because there's only one, it's around knowing what measurement, monitoring, and evaluation should be conducted and how it links clearly back to the heart of your strategies. Putting metrics on the table, putting ways of understanding impact on the table that others might not think about, and really being able to pull together the insight from those review activities to feed back into your strategic planning and interpret those in a way that others might not. And then if we look at some of those priority enabling general competencies, which is quite a mouthful, two of them there are around influencing and working with complexity, uncertainty. So with that influencing, it's that ability to build that buy-in of what strategic planning can offer, that the importance of investing in good practice in strategic planning, and then the importance of having those long-term visions in order to be able to achieve good outcomes. And the importance of having that wider sense, that system-wide whole workforce long-term view of things, and being able to influence others to feel and believe those things are important as well. In terms of working with complexity, uncertainty, it's that ability to say, yes, this is messy, yes, this is complex. What I'm not going to do is put an artificial box around it to keep my planning simple, because that box is so heavily influenced by things outside of the control of that box that actually it becomes meaningless when it hits implementation. So that's run us through the kind of overall framework. What we're going to do in a minute is just look at how we use that good practice skills for strategic planning. But I am just going to give everybody an opportunity to, while it's fresh in their mind, put any questions into the chat, and then we will be able to pick that up at the very end and pull that. But we're going to move on to using the framework. So if there's any questions about the what of the framework, now's your time to put that in the chat. So in terms of using the good practice skills for strategic planning resource, the idea is that there are multiple ways that this can be used. The first is for staff to get a sense of where they feel like they sit and where they feel like they want to develop more, to facilitate that conversation between a line manager and a staff member about the areas for future development that can go into the PDPs, that can go into where the money goes and invests in professional development within the organisation, and where that person's continuous professional development time is invested in. It can also help the teams to understand where they need a skill mix across the team versus within an individual. It's able for team leaders to be able to say, okay, I want to foster these baseline skills in all of my staff, but actually I know I've got specialists in certain parts of this, and I'm quite keen to work out how to leverage that as peer support rather than trying to build those same skills in everybody. It also enables a manager to say, actually, where do I want my team to be in the future? And how do I, through changes to the way our team works, job descriptions, or even waiting for that natural attrition and turnover, how does it shape my future hiring decisions? How does it shape my future job descriptions? And how does it shape how I deploy the staff that I have? Who do I buddy up with who on a particular task to get the best skill mix? Who do I have leading a particular piece of work based on a natural skill set? Or where do I need to invest in a particular skill set in an individual because they're on a project of some description that requires that skill set? So there are multiple elements to it. But at the essence of it, what it is saying you have different roles in your teams. And so each of the sophistication and level of the skills and competencies required in each of those different roles is up to you to define. Through our external prototyping, we have noted that generally your 8As, the expectations from managers are similar in terms of that level. But then also we know that different teams break down skill sets in a different way. So what we've got here is an underpinning level of competency, where somebody goes from unaware to expert through the ranking of 1 to 5. And what you might do is take, and there's a table later on, and look at each of your bandings or each of your specific types of roles and say, where do I expect my staff to be on those? Just like individual staff can go, where do I feel like I am on those at the moment? So 0 would be no awareness or knowledge and no application required. Now we know that a lot of strategic planning teams keep their project support team quite close and say actually an administrative officer isn't interchangeable when they're working in the strategic planning space. There are some parts of that role that require some of these to maybe even 1 or 2 with some of the 0s. So there is a role for that 0 to play in there. The next one is around that awareness of knowledge needed for the competency, but no application is required. They can explain what an options appraisal is and when you might use it, but not necessarily being able to actually go through and do it themselves wouldn't be an expectation. 2 is around practiced. So you've got that working knowledge. You're able to understand more of the detail and the intricacies of a particular task or a particular worldview. And under supervision in non-complex situations, you can do that kind of work in a practiced sense. Competent would be around 3, and this is that comprehensive knowledge and the ability to comprehensively apply that competency in situations with limited complexity, with limited support. Around proficient is that new detailed knowledge. Can you critically evaluate and adapt the approaches that you're taking? Can you apply it independently in complex situations? Can you troubleshoot it? Can you support others to do this? Can you be recognized by non-planners as a skilled planner? All the way through to 5, which is that expert level where you are seen and sought out by other planners as that level of expertise. You're able to troubleshoot, you're able to support others' development in these skills, and you're able to apply a different set of skills in every scenario that matches that scenario's need. So what we did is we put a table in here that enables a staff member to go through and rate how they feel they're doing against each of those competencies, or for a planning management team to sit down and go, what are the different roles and what do we expect? Or for a director of planning to go, where do I want my organisation to be and what planning skills do I need in the team in order to do this? So what you can do is use this table to go through your team and identify where you want people to be at. You can use this as a self-assessment tool. You can use it as the basis for a performance conversation, setting you new targets for the new years. But also teams can bring it together to act as a foundation for a team development plan and a more planned and coordinated way of working with each other to bring out those skills that are needed across the team. So what we've got is we're going to talk to two people. The first is Viv, who is the Deputy Head of Strategic Planning and Commission in Dumfries and Galloway, and she's submitted a recording. Leanne, I'll let you take back control of the slide so I don't mess that up. And then next after that, we have Wendy Forrest, who's joined the call, and she's the Head of Strategic Planning and Health Improvement in Claxon Stirling HSCP. And both of them are going to talk a little bit about the external prototyping that we did with them.
Hi, my name is Viv Gration and I lead the Strategic Planning and Commissioning team for the Health and Social Care Partnership in Dumfries and Galloway. I'm delighted to share with you our experience of the Good Practices Skills resource from Healthcare Improvement Scotland and the work that we've done with Claire in terms of helping to try that out. I was very keen to use the resources because I've got quite an eclectic team of people with very different backgrounds, and some who have come into planning from other aspects of health and social care are maybe struggling a little bit to really get to grips with what the role of, in our case, strategic planning commissioning managers is all about, and really getting to understand what it means to be strategic in our thinking and in our approach to what we do. I was really hoping that by having a sort of shared language and a real understanding of what it is to be what strategic skills are would be really helpful, and I think it has been for our team. We used the resources in Claire Hammond from HIS very kindly came and facilitated a couple of workshops with my team of 7 managers, and we went through that. Claire would be able to give any more information on that if you wanted, and that gave us a really good grounding for folks to share what they understood, and has really helped them to get to grips with what their role and function actually is. What we've done with the resource now is all of the members of the team have undertaken a self-assessment. So looking at each of the skills in turn and giving themselves a score about how well they think they meet that, where they think there are gaps. And we've tried to explore together evidence for them to be able to demonstrate that they are at that level with that particular skill. It's helping us also to identify skills across the team so that we can help each other much more. So if there's a particular area that I'm not as strong on as one of the other members of the team, then we can work together on that. I've taken the self-assessment and matched alongside an assessment that I've done as the line manager for members of my team, and we've taken that into conversations in our one-to-ones about where there might be some gaps, where there might be some opportunities to learn some of these additional skills, or indeed where they have really good experience and skills in a particular area. And we've already run a skills sharing workshop around how you approach the writing of reports and papers on such complex pieces of work that we do. So that's something that's happened within the team. I think that the resource is absolutely marvellous. I think it's really helpful in introducing colleagues with a non-strategic background to really understand what that is, and breaks down all the different aspects of what it is that we do that can sometimes be a bit tricky to get to grips with when we're moving into this space. And it's been really good, I think. I think it's very accessible. The way that it's laid out is really helpful. And for someone like me that has been in strategy for a long time, it can sometimes be difficult to really explain in a different way that isn't just so instinctive for me. So I think that's its real strength, is bringing that to the fore. It takes a bit of time, I would say, in investing a little bit of time with yourselves, with your colleagues, around understanding that. I would say so that it does need to have that time dedicated to it to get the most out of it. And I think we're very much just at the start of our journey around that, and I'm hoping that we can redo our self-assessments and assessments of my assessment of the team in a year or so to see how well we've done in terms of addressing some of those gaps or sharing the skills that we've got across the team. I'm hugely grateful to Claire and colleagues for enabling us to do that and take advantage of their skills and approaches. And I'm a big fan of the Good Practice Skills resource. So I would encourage anyone to take a look at that for team development, for your own personal development. And it's been hugely beneficial to us in Dumfries and Galloway.
So my name is Wendy Forrest, and I'm the Head of Strategic Planning and Health Improvement for Clackmannanshire and Stirling Health and Social Care Partnership. I've been here for around 4.5 years, and for those of you with organisational memory, you will remember that's about the time that COVID hit the world, as it were. And so in terms of coming in as the head of planning with a very small planning team, we used the tool to think about, and to be honest, I was really grateful to Zed and to Claire, because after 2 years of doing what felt like very urgent work rather than important work in terms of where we wanted to be, it felt a really tedious offering from our colleagues with Healthcare Improvement Scotland to think about the development of the framework within that strategic planning context. I think it's worth saying, and this might be controversial in this call, the technical process of planning for me is quite different from quality improvement. It's quite different from project management. I think Claire has really helpfully described in a very concise and well laid out way what the function of planning is and should feel like in terms of that technical process that we would do internally within the Health and Social Care Partnership. I think it's also worth saying, though, that for people who are part of a planning process, if we have those technical skills laid out as clearly as they are, it means that for people participating, whether it's patients, supported people, their carers, our operational colleagues, it should feel really easy and breezy. It should feel like something that people want to be part of, that they feel empowered and they feel part of a really meaningful process where they are listened to and heard. And I think for me, and the way that we've used it within our team is we met with Claire a couple of times to actually go through the descriptions which she's just presented within her presentation there. And those descriptions, and if I share, one of my planning managers had actually said, I've never discussed and talked about strategic planning in this very focused and interesting way. And actually it really describes the role that I've got. And I think for me and for them, and I don't want to speak for them, but actually I think for the planning managers and the wider team to be able to see it all laid out in the way that Claire has done and the team, the wider team have done, has made it really easy for colleagues to have that self-evaluation and think about what their skills are, where the gaps are, and where they would want to be. And I think the other thing that I am using the framework for is succession planning, which I know colleagues around this call will know that we do not do well across the system. But actually, if we are to build the skills, experience and knowledge going forward, then we need these types of tools for people to self-evaluate their own skills, but also how do we succession plan? How do we look at what we need going forward and in the future? So I think for me, to have something as concise and clear as what has been presented, and having the opportunity with colleagues to develop it with them and to have the lived experience of going from, and you will all remember the mobilisation plans that we had to do during the pandemic, which felt like they were daily updates. I don't think it was, but I felt like daily updates, I think was really, really important. I think for me, the bit that's also really important is we focus a lot, as I've just said, around mobilisation on the urgent. We don't always focus on the important, and the important role of planning for me and my team is where do we want to be in 5 years? Where do we want to be in 10 years? And that aligns as well into that succession planning around what that looks like for us going forward. So I think in terms of what needs to happen in terms of how we used it and how we want to use it going forward is we work in quite a challenging environment within health and social care partnerships, because we have local authority plans, we have health board plans, and we are almost in that space in the Venn diagram in the middle. So the way Claire has described that influencing role, that role of how we describe, how we engage, and how we are part of and leading that planning process without directing, I think is really important. So for us, having this tool to describe what is for me a very technical role has been invaluable, and my sincere thanks to Zed and to Claire and the wider team for their enthusiasm in taking on board the ideas that we offered up. Thank you very much.
Perfect. Thank you, Wendy. Appreciate it. Just waiting for the slides to go back up, and then we can talk to you about the support that's available before we move on to question and answers. So what we have got is the Good Practice Skills for Strategic Planning resource, which is up online, and you can follow it using that QR code or by searching Good Practice Skills for Strategic Planning Healthcare Improvement Scotland. You also will be able to get a link to it through the invite that you've had. What we're going to do is turn all of these questions in our question and answer round and make the recording available so that way you can use that as FAQs. We've quite intensively supported 4 different HSCPs and boards during the external prototyping process, and so they had quite a supported step-by-step in terms of walking through that. What we are able to offer others is that if you are looking to use it with your team and you're just wanting a bit of advice or guidance or sense checking, or you're partway through the process and you want some advice, then please do get in touch, and there's an email address going into the chat later and at the end of the slide pack, which you'll also get, that enables you to reach out to us and we can have a chat about that. It's not a required resource. This is designed to be a helpful resource that teams can choose to use if they want. It doesn't come with any requirements to use it, and it doesn't come with any requirements to use it in the way that we've intended it to be used. There is the option and flexibility for you to do what you want with it, and if you need our help and advice and support, then we're just on the end of the email and then a phone call.